So now it's my part of the show. So everything we've been talking about so far has nothing to do with the company you work for. This is everything we've been talking about relates to federal programs being Medicare and Social Security, obviously, at the beginning. Whether you work for Stellantis, whether you work for ABC company, whether you work for mom and pop, it doesn't matter. You know, once you turn 65, Medicare rolls in as long as you were a US citizen. What we're talking about right now are very specific to Chrysler, FCA, Daimler Chrysler, Stellantis, pick your name. So we're going to be talking about what's called a retirement healthcare account, or RICA, and a healthcare retirement account, HRA, and via benefits. So when you worked for that laundry list of companies that all are up, headquarters in Highland Park or Auburn Hills now, you had an option of having a retirement account, a RICA. So, as I was saying, when you were employed, you had the option of putting money into a retirement healthcare account. Can I see a show of hands? How many people in the room actually used or have a RICA account? Oh, about half or so, half to 3/4. Okay. So a RICA account was something that you were able to use or to contribute either through your own contributions, and they were after-tax contributions, or there were some options that the mother company gave us as matching funds. I think they were after-tax contributions, I believe. Doesn't matter. At this point, this was 5, 10, 20 years ago for most of us. So first of all, this RICA situation or option is, as far as we know, purely a Chrysler manifestation. You can talk to your neighbors, and if you talk about a RICA, they won't know what you're talking about. So this was something that Chrysler developed, and it's legal through the federal government. They have to go through the IRS to get approval. But this is something that kind of is a very unique Chrysler manifestation. The funds that you've got when you contributed, either your own funds or through the corporation with matching funds, those money are housed along with your 401k in a separate account through Merrill Lynch, which is also Bank of America. Merrill Lynch merged with Bank of America during the Great Recession of 2008. So you can file, so these RICA accounts you can use to pay your healthcare accounts, or your healthcare costs, I should say. And you have that money, the window, so during when you're working, the money's going in. You can start taking money out at one of two dates, whichever is later, either when you left the company or age 55, whichever comes later, okay? So those dollars, assuming that you're over 55, is available to you right now, as long as you're not working for the company still. You can use those funds that you put away back when you worked for a whole laundry list of items. Medical drug premiums, deductibles, co-pays, co-insurance, long-term care premiums, out-of-pocket costs, dental, vision, hearing. The only rule is that you can only have the expenses when they're occurred after you were eligible. So you can't kind of predate these expenses. Whenever you became eligible to take money out, that is the effective date of when, the receipt that you send in to via benefits will be effective. As I said, you can use this for a whole bunch of expenses, and this is very similar set of rules to when you're working in using what's called an FSA, a flexible spending account. or a healthcare retirement account, which is another option that you can use through the federal government. So all of them basically use the same guidelines for what can be submitted. Medicare, Medigap, and insurance premiums in general, office visits, prescription drugs, most over-the-counter medications and products, medical supplies, wheelchairs, walkers, things like that. There are some that are ineligible, cosmetic drugs, and some over-the-counter products like toothbrushes, hand lotion, things like that. I believe long-term care is listed. Yep, right here, long-term care. Yep. Yes, sir.
Long-term care premiums, I know, but long-term care fees, like $5,000, $6,000 a month, I don't think so.
All right, so what we're saying is long-term care premiums we think are eligible, long-term care expenses we think are not, but the key is on the Via Benefits website, they have a whole list of eligible expenses. So for your particular situation, go in as multi pages of all these different different types of expenses and what is covered and what is not covered, or eligible, I should not cover, but eligible with it. All right, well, okay, so it sounds like long-term care expenses over and above your insurance premiums are covered, we're hearing. Best thing to do, check the website. The process of actually taking money out of this can get a little complicated, unfortunately, because you've got two companies that you're working with. You have Via Benefits, excuse me. Via Benefits is kind of the gatekeeper. They're the ones who you submit the claims to Via Benefits, and they will look and make sure that you followed all the rules. And all the date, that the dates are on all the receipts are correct, and you've got all the information you need, etc. So there's a whole bunch of rules. They will make sure that you've done everything correctly. But Via Benefits doesn't have the money. The money sits with Merrill Lynch. Via Benefits has no knowledge about what you have in your Merrill Lynch account. They have absolutely no visibility to that. So what you need to do is when you're about to submit a claim for $500, you need to go to your Merrill Lynch account and move money in your Merrill Lynch account out of any stocks, bonds, whatever you might, or mutual funds you have invested in, and move it into a Merrill Lynch Industrial Money Market Fund. So you call Merrill Lynch, or you can go on their website, and if you have an account, and you can move the money from one place into this special account. Then, once that is completed, then you submit the claim to Via Benefits. This process on the Via Benefits side can take a week or 2 or even 3 weeks, depending upon the timing of when you submit the claim. But what Via Benefits does, it says their reimbursements happen on a weekly basis. I'm not sure whether it's Monday or Thursday or Friday, but somehow on a weekly basis, Via Benefits will send, and it's Via Benefits accounts. That's a distinction. There are 2 Via Benefits. There's regular Via Benefits, and they are consultants. They will help you, as our consultants will, get Medicare insurance policies, as we were talking about over the last few hours. But Via Benefits accounts, which is a separate department of Via Benefits, they handle this reimbursement process. But they are 2 separate arms of the same company, ViaBenefits.com and Via Benefits accounts. So Via Benefits accounts will submit the claim that you submitted to Merrill Lynch. If the money is available in your account because you did everything correctly, great. if you didn't do that first step of talking to Merrill Lynch, via benefits accounts will reject your claim. So you've got to do this in the right order in order to make this whole thing work. And as you can see, between this connection between these two companies, and also because they just do it on the via benefits accounts, just sends us over on a weekly basis, this can take some time, unfortunately. So we give you here telephone numbers and websites of where you would be calling to do that transfer within your Merrill Lynch account on RICA. All of this, again, all of this detail will be on our website. And quite frankly, a lot of this is the same as last year. So even today, you can go on our website from last year's presentation, and 90% of this is 98% is the same. So that's if you had a RICA account when you worked. Now you can reap the benefits of what you did, the money that you took out of your take-home pay back in the day when you were working. But there's another account there. It's called an HRA, a healthcare retirement account. When you are below 65, that doesn't exist. You have a RICA account on Merrill Lynch, you might have your 401k, great. An HSA, exactly, healthcare savings account, and for those of people who have it. But when you turn age 65, the Lord giveth and the Lord taketh away. The Lord taketh away, Chrysler takes away, or Stellantis takes away your healthcare insurance and says, good luck, get on Medicare. But what they do is they give you a healthcare retirement account. Healthcare retirement account is given to you, both the retiree and to the spouse, depending upon when the retiree or the spouse turns age 65. The retiree could turn age 65 first, or the spouse could turn age 65 first, whichever it is. You will get in this account either 1975 your retiree or 1750 your spouse, but that amount is reduced potentially for the age and service subsidy or subsidy that you received when you retired. So it's the same percentage as you had on your pension. Many people, depending upon when you retired and the number of years of service and your age, have 100%. Some people, if they retired earlier, I retired at age 55, and I think my percentage is 88%. Whatever it is on your paperwork, and it affects your pension that you've been getting. Excuse me. That same percentage is applied to this 1975 or 1750. So when you or your spouse turn that age, you will be getting an account for that 1975, 1750 times that 100%, 88%, 75%, whatever it is. That money does not go to Merrill Lynch. That money goes into an account within via benefits or via benefits accounts. So when you're retired and you're age 65, you might potentially have two accounts, one in Merrill Lynch that you put in yourself, one that is given to you by the company age 65, and it's one account, whether it's a spouse or your money, that money is commingled in one account. You can submit claims against that money. And the rules are the same rules that we just talked about earlier for Medicare premiums or out-of-pocket expenses, dental, vision. It's the same set of rules. Those rules are really set by the federal government, so that all our company does is just copies whatever the federal government has. And that's, as I said, you can get that off of via benefits account website to get the laundry list. Those monies become available to you when you turn age 65, either you or your spouse. And you cannot you cannot put in claims dated prior to that date of when you got the money in the first place. Oh, by the way, this money, 1975, 1750, et cetera, if you turn age 65 in September, that money is prorated for that first year. So you'll get, if let's say October 1st, you turn age 65, you'll get 1/4 of that amount of money for that first year. And then January 1st, you get the whole amount. And these monies, you submit claims and it can accumulate. It's not use it or lose it, as some of the flexible spending accounts when you were working, which is, as of January 1st or April 1st, it was, put the claims in or the money goes bye-bye. Those monies will all be there and they can accumulate. Now, this 1975-1750 that we very generously received from our mothership in Auburn Hills, that number has not changed in a decade, 15 years. I mean, basically, it's been there, that same amount of money for many, many years. But the cost of Medicare and the cost of medical expenses have been continuing to rise. So when FCA US first gave us this money, we all have Medicare Part B claims or insurance costs, as both Paul and John were telling you. But that number has been increasing every year. The amount of money that we have in the kitty has not been. So it used to be that the money that we got from FCA covered maybe all of that Part B premium, and you had a whole bunch of wiggle room, extra money that you could spend for out of pocket. But right now, that 1975 and 1750, less that age and service subsidy, is below what the Medicare Part B premium is. So basically, you spend all the money that you get from FCA, it's your option, but can use that money 100% for the Part B premium that you all have to have in order to get any Medicare coverage whatsoever. Now, there is a electronic option that Via Benefits Accounts gives you, which is you can click a button on the Via Benefits account, and I'll show you how to set that up in a second for people that are new to the system. Oh, you don't have to click a button. It's automatic now. It used to be click a button. There was a change in the supplier. It's automatic. That will be automatically reimbursed every month. So Via Benefits Accounts has a listing, or can submit to CMS, the Center of Medicare and Medicaid in Washington, D.C., and find out whether you are on Medicare Part B. They know that. So that if you're on Medicare Part B, there's a little button that says, yep, or a little flag that says, yep, John Kaiser is on Medicare Part B. And as long as that button on the website is clicked on, which by default it is, you can turn it off, but by default it's turned on, automatically you will get that claim submitted. You don't, untouched by human hands. You don't have to do it yourself. It will take care of it all itself, and will take the money out of that. Oh, the money of the 1975 and the 1750, you'll get that like the first week of January of every year. And then every month it'll increment down if you have this button turned on of your $170 odd of Medicare Part B. And if it's two people, a retiring and a spouse, it'll be what, 175 times 2. So you'll have 2 sets of money you get in January and 2 claims every month that'll automatically get put against that amount of money. So that option of doing this electronically is available in your RHA or the HRA, but is not available in your RICA. So that option is available in one of the accounts, but not in the other. And those are the rules that FCA and VIA benefits accounts have decided. We've talked to them and they've said that that's the way it is, that option is available, but only in one and not the other one of the accounts. So how do you get access to this VIA benefits accounts thing? Well, you can go either two options. You can go onto the Benefits Express or Benefit Connect, Benefit Connect website, where your pension is monitored and hopefully you have an account there and you can put your withholding taxes and all these other things related to your pension. But there is a button on there which allows you, here's the cursor, which allows you to access, and it'll link you to VIA benefits accounts. Oh, there it is, blown up. So this gets you to your flexible spending account, RICA, or VIA flexible spending account was when you were working. That was a benefit that you had as an employee, and then to your healthcare retirement account or RICA. Or you can go directly to the website yourself. And here's the website address, viabenefitsaccounts.com. Again, all this information, these websites are all on your agenda, or you can go to the ncro.org website and see all this information. When you're new to the system, you'll get this kind of a screen. What you want to do is you want to go to create an account down below there with that arrow. And you'll get them to this screen. And it gives you two options, employee ID or social security number. Please use social security number. This does not work. So do not use your Chrysler ID number. It doesn't know what you're talking about because VIA benefits doesn't have that. So even though it's the first entry item, we learned this the hard way, that go and use the social security number option. It will then ask you a whole bunch of questions, enter birth date and zip code. It'll prompt you for email address. It'll do a whole bunch of validation to make sure that you are you. It'll also ask you for direct deposit information. Key thing. This year, 2023, for the first time, and I think it was at the end of 2022, we used to be able to get paper checks out of the system. But as of this year, VIA benefits accounts said everything must be electronic, ACH. So you'll have to enter your routing number and your bank account number off of your checking account to go into it. And possibly you can even go to your savings account. But paper checks is not an option anymore. Of course, there's an app. There's always an app these days. So there's a VIA benefits accounts app you can get off of Google Play or the App Store. There is also the old-fashioned pencil and paper way of a paper claim form. And as was mentioned earlier, we have totally revamped the NCRO website so that right now, this is the new ncro.org website. And for a lot of this RICA and RHCA information, you want to go to this section under reimbursements. And it'll give you all these links like slide presentations from last year and videos from last year. And in a few weeks, you'll have the 2023 options. Maybe. Naysayer over here. You can be replaced. No, you can't be, matter of fact. Moving on. Now also, so what we've also done is with the redesign, the insurance committee spent a lot of time. We used to have all of our links kind of commingled. So now we very specifically set up very carefully a reimbursement section, which is everything I've been talking about. And then we have a Medicare section, which is what we talked about earlier in the day. It really is two sides of a coin. There's getting the insurance itself, and then once you've got the insurance and the cost, how do I get reimbursed out of these accounts that get set up for you? So on the on the reimbursement, that was what I was just talking about. And on the health insurance, we have two options. One is when you're on Medicare, and two, pre-Medicare, which some of the people here are, kind of phasing into Medicare at age 63 or 64, getting ready for 65. And some of us older people are already on Medicare, so that's the section you want to go to. And we've got all the websites related to, like the presentations related to Medicare, like John was giving a Medicare Advantage and Medigap, Part D, all that stuff is over on the Medicare, on the health insurance tab, as opposed to the reimbursement tab. We also have under pensions and Social Security, because those are kind of annuities, the annuity from your pension coming out of when you worked at Chrysler or out of Social Security, which is like a federal pension, quote unquote. So under, so the information that Paul started out with will be all housed under the Social Security tab. So we've really tried to make it a lot easier for you, a lot more user-friendly. And here's just the contact information with the telephone number for Benefit Connect, via benefits accounts, Merrill Lynch for that RICA piece of it, where the money is sitting. And as we say, break glass when all else fails, inscom or at ncro.org, and you'll get access to us. So, any questions related to that? Nope. Oh, okay. We've got someone walking on over there.
Howard, you didn't talk about HSAs, which some people you can contribute to even after you're retired, but not after 65.
Very correct.
But for HSAs, you get a tax form.
Yep.
Every year, a couple of tax forms actually. Yep. With this HRA, you do not. Can you briefly touch on why that would be? Sure.
So, and I'm even going to bring up another good question, and I'll elaborate even further on it. So an HSA, healthcare savings account, has absolutely nothing to do, well, I shouldn't say nothing, but it is a federal benefit that Congress gave lots of people in the country if you were under a high cost, high deductible healthcare plan. And it is something, as Pat said, you will get actual forms from Bank of America, I think, with how much money you got put in or was put into it for the HSA and how much money you take out of the HSA. That information has to be filed on your federal tax 1040 return every year. Not everyone has an HSA. It depends upon what healthcare option you had when you were working or when you were retired, but getting health insurance from the mothership. Now, when you retire, when you turn age 65, you cannot, and even I think at age 64, there's some timing things, and you might want to talk to your CPA about this. You can no longer contribute to an HSA. So, but once the money is there, you can take money out for as long as you want, until you unfortunately pass away. So you can take money out after age 65, but it is illegal for you to put money into an HSA after you turn 65. So this is another question when you are turning age, when you're age 64 and you're in this, either you or your spouse are in this transition phase between the Chrysler options and Medicare, that you'll want to start talking to Benefit Connect about how do you want to handle these things, and also talking to your tax advisor. Now, did that answer your question? So why you don't get a tax form, that is the agreement that, or the option that Stellantis has with the IRS, that all of this HRA benefit is tax-free for us. It's all a before tax situation, so that you will get no tax forms whatsoever on any of that. And you also don't get any tax forms when you take money out of your RICA account. Yep. Yes, John.
When you're both gone,
I was getting there.
I'm sorry,
No, okay.
your beneficiaries have 1 year to file claims for you to get HRA money. The RHCA becomes a benefit, a taxable benefit, almost like you inherited an IRA.
It's your money.
But you lose the HRA money if there's money there after that time period where you file claims.
Correct.
I'm sorry.
No, absolutely. That was the add-on I was going to go to. So yeah, the RICA is your money, and you can put a beneficiary under it. You have to go onto Merrill Lynch and put beneficiaries, and it's, when it goes to beneficiary, they can't use it for healthcare expenses. It'll be going to them, but it's a taxable event. But the HRA is purely Stellantis's money. You can use it, but that is use it or lose it when you pass away. So you have, as John said, I think your heirs or your spouse, if they're still around, can put claims for you or them, I think, afterwards. But once both of you go, that money goes bye-bye. And it goes back into the corporation's coffers.
And the spouse will step up to the 1975 if we retire the guy. The spouse will go from 1750.
Yeah, what John is saying is the money's once if the employee or the retiree passed away and now just you have a surviving spouse, that surviving spouse monies will be kicked up from the 1750 up to the retiree's amount of money that they were getting. But you'll get basically half the amount of money because now you just got one person alive, not two, but they will get the higher of the two benefits. Isn't this fun? Yes, Gordy, that's a question from the web.
So,
Or-
Howard, on your RHCA slide, you skipped over one section that says RHCA funds that are set aside to cover premium shortfalls can also be used for other claims. What is that?
Which slide is this, my friend?
Your RHCA slide.
RHCA, this one?
Go back one more, I think. Maybe another one.
That's it. So,
I think when you
Go one more, then go forward one. Keep going. There, that slide right there, your third paragraph.
okay. On the premium shortfalls, you're saying?
I don't know, I don't understand that.
Okay. So you have an option, and I'm trying to remember exactly what this is referring to, but I think I do. When you're retired, but still under age 65, you have the option as a retiree between age 55 and 65 to still have Chrysler insurance, but have that premium paid for out of your RICA fund. And if you take that option, you don't have to, but if you take that option, what Merrill Lynch does and what Benefit Connect / Stellantis require you to do is in the fall of the year, say, I want to have my money, let's say it's $100 a month for, just makes things simple, $100 a month for premiums, that's $1,200 a year. Merrill Lynch will move $1,200 into a frozen account. So that money is guaranteed up front in the fall for the next 12 months, January through December, and you can't touch it. It's there guaranteed so that Chrysler, if you check that box, Chrysler says, we don't trust you that you can use that RICA money for something else. We will freeze that money into an area and cannot be used for anything else. So that's what that is. So that's not everyone, as you can see, there are lots of options here. Not everyone has a RICA account, and not everyone is going to be using that RICA account if they have it for paying the premiums on their health insurance before they're age 65. So lots of ifs in that statement. That's what that means. Any other questions? Okay. So let me move on to the next presentation. You certainly can, John.
I'll be quick. On the website, there is what's called a survivor guide. And the reason I mention that, it's for the benefit when one of the spouses passes or both. So you've got when the retiree dies, you got when the spouse dies, and for your kids when you're both gone. And the reason I mention it now, it has details on how the RICA works, how the HRA works, the things we're mentioning. And it's got a lot, and it explains almost everything. So even though no one's passed, it's a very good read. It's called the Survivor Guide. And there's a second piece called the Family Guide, which you can hand to your kids. It's information on what everyone should keep in case someone passes. So both those documents are worth a read or to be aware of.
And this is very important, which we all should have, is some sort of estate plan, wills, trusts, medical, medical issues. If you know, what happens if you're on a, if you're not able to speak at a hospital, how do you want your survivors to handle your medical situations? All these things you should be working with a lawyer on, and that document that John talked about is incredibly important for these unique Chrysler benefits that your lawyer probably will not, almost definitely will not be aware of.